Hello everyone, and welcome to another Clayton Valley Village Lunch and Learn presentation. Clayton Valley Village is a 501c3 nonprofit organization serving seniors living in Clayton and Concord. My name is Carol Hanson-Gray, and I'm honored to serve as their executive director. Clayton Valley Village, founded in 2014, is part of a network of over 400 villages throughout the country, whose mission is to help our members live independently in their own homes as they age by providing social and educational events, as well as an array of home-based services through our volunteer network. Please visit our website at claytonvalleyvillage.org for more information about us and how you can become a member and/or a volunteer. Today, we welcome Micki Nozaki, Director of the California Health Advocates Healthcare Protection Program. That's a real mouthful there, but it's also known as Senior Medicare Patrol. This federally funded program provides Medicare fraud prevention, education, and outreach throughout California to older adults, their families, and caregivers, as well as persons with disabilities. Prior to assuming her current role, Micki spent many years in the private sector. Healthcare fraud is elder abuse, and Micki is deeply passionate about protecting older adults and persons with disabilities from being victimized by criminal fraudsters and scammers. She asks that we all do our part to protect those most vulnerable among us. All of our presentations are recorded and can be accessed on our YouTube channel at youtube.com/claytonvalleyvillage.org. No, just Clayton Valley Village. youtube.com/Clayton Valley Village. During this presentation, everyone will be muted. If you have questions during the presentation, please type them into the chat feature, and at the appropriate time, I will read the questions to Micki for her to answer. So please sit back, eat your lunch if you brought one, and enjoy. Micki, I'm now turning it over to you.
Okay, alrighty. Hi everybody. Let me get the slideshow up and we shall begin. Alrighty. Thank you for joining us all today. So, we're going to talk today about COVID-19 scams and healthcare fraud. And believe it or not, the COVID-19 scams keep coming. We can hardly keep track of everything. So here we are in July, and tragically, still in the midst of the coronavirus COVID-19 pandemic. An epidemic that has thrust us into a world of confusion and uncertainty. And this confusion and uncertainty triggers anxiety and fear. Now, to underscore this, I want to point to a survey that's actually being done by the United States Census Bureau, partnering with the National Center for Health Statistics. And they've been doing this survey since April, trying to gauge state by state how many adults in each state report symptoms of anxiety or depressive disorder during this COVID-19 pandemic. And I got to tell you, the data is astounding. I looked at the California data for the month of May. The California survey data shows almost 40% of the adult respondents confirm they're either anxious or depressed. And other states are reporting higher numbers than that. During this pandemic, we are at a higher risk of experiencing stress, fear, worry, uncertainty, and loneliness. And I gotta tell you, the criminals are feeding on those emotions. And scammers, boy, they know exactly what buttons to push. They incite fear by making something sound urgent. They say, you need to act right now, pressuring people into giving up their personal information, targeting bank account information, Medicare numbers, and Social Security numbers. Now, a perfect example of this type of scam is the Social Security Administration scam robocall, which, by the way, is rearing its ugly head once again. And it scares people into believing that their benefits have been suspended. I mean, there's so many people that live on Social Security. It's a horrible, horrible scam. The robocall warns, quote, "Your case is critical, time sensitive. It requires your urgent attention," end quote. Make no mistake, the criminal scammers are out to steal billions of dollars from Medicare and us and inflict as much harm on our seniors as they can get away with. And fear, confusion leads to isolation, loneliness. Many of our elders face language challenges, all of which makes them extremely vulnerable. Case in point, our senior Medicare patrol got a report last week from an elderly woman who told us she had gotten a call from the California COVID team. She said that the caller, who represented herself as a Medicare representative, engaged her in friendly conversation in her own native language, but after a while began to pressure her into providing her full name, date of birth, and Medicare number. Just one scam example among many, many, many scams. I tell you, the scammers, they are thriving. And the schemes that they're using evolve over time. So let's take a look at some of the trends that we're watching right now. Scammers offering free COVID tests in exchange for Medicare numbers. Providers who see financial gain in billing Medicare for false claims using COVID as a diagnosis. Increasing telehealth and telemedicine fraud. Scammers who have glommed onto contact tracing to trick people into giving up personal information. The many, many, many fake websites and charities and hundreds of products making money off of this fear and confusion. Criminal scammers going after people's much needed economic stimulus payments. We see the old 2019 genetic testing cancer screening scam spruced up for 2020. And sadly, hospice agencies fraudulently enrolling non-terminal seniors into hospice using COVID-19 as a diagnosis. And lastly, the rogue insurance agents or the scammers masquerading as insurance agents, convincing folk to enroll in a health plan that definitely isn't good for the beneficiary, but lines the pocket of the scammer. Now, we'll go into detail on all of these scams, but first, let's take a look at Medicare's new rulings around COVID-19. Now, why do I want to share this information with you guys? Medicare is trying to be as flexible as possible in this COVID-19 pandemic world. And so they're modifying and making very flexible the rules around Medicare coverage and payments. But a lot of people don't know this. In fact, it's almost impossible for the layperson to understand all of the intricacies of the Medicare rules, even in ordinary times. And when you don't know about the rules, it's much easier for you to fall victim to the scammers and the fraudsters. But these are not ordinary times. And the government rules around Medicare COVID testing are evolving. So here's some updates that you can share with others in the hopes that we can stop people from falling victim to the criminals. Medicare Part B covers the cost of the COVID-19 test. Beneficiaries, Medicare beneficiaries, do not incur cost sharing for the COVID-19 test. And yet, we hear about beneficiaries being tricked into paying out of pocket for the coronavirus test. The testing, COVID-19 testing, can occur at multiple locations: parking lots, drive-thrus, Sometimes even approved providers can take specimens in seniors' homes. Now, for those members who are Medicare Advantage Plan or HMO members, Medicare Advantage plans also do not pass on charges for the coronavirus COVID-19 testing. And Medicare not only covers the coronavirus COVID-19 testing, it also covers what we hear in the news a lot now, the COVID antibody test. Now, the antibody test is an FDA authorized test to help to see if a person has developed an immune response and is not at that point at immediate risk of COVID-19 reinfection. So the COVID-19 and the antibody test are covered by Medicare. So please share this information because the bad actors are already scamming people. And what are they doing? They're telling people that there's a charge for the COVID and antibody tests. Scammers are emailing and texting seniors telling them that the government is actually mandating that everybody in the country has to take an antibody test. Not true, it's a scam. Or scammers are telling people that, enticing them to take the test with a promise that if you take the test, you'll get paid. Also a scam. When all the scammers want is your personal information, your birth date, your Medicare number, your social security number. So the best advice, always, always, always check with your own doctor. Now, unfortunately, some of our seniors in Central California didn't check with their own doctor. Now, we recently learned of a doctor in Butte County who advertised his very accurate COVID-19 antibody test, which he was delivering at a local junior high school drive-thru. You don't even need to get out of your car, he said. He even promoted his test on television. So unfortunately, these ladies submitted to the testing. They had their blood drawn. They even signed some paperwork, although they admitted they really weren't quite sure what they were signing. And then they found out that they had to pay over $50 a piece out of pocket for the test. And when they questioned that, the doctor said, "You want your money back? Go bill Medicare yourself." And to add insult to injury, when they got their Medicare summary notices, it showed the doctor billed not only Medicare for the test, Medicare was also billed for an office visit and other services that the ladies clearly did not receive. Yep, that is COVID-19 fraud. In another case, also in California, we've heard about several laboratories that are hiring marketers. And those marketers are paid on commission. Now, here's the way the scheme goes. The laboratories hire these marketers. The marketers go out to their communities and they either call people on the phone or they go door to door. And all they want from people is their Medicare number, and for as many Medicare numbers as they collect, using whatever devious argument, convincing argument they can, they collect these Medicare numbers from these unsuspecting beneficiaries because they in turn get paid by the laboratories for how much each laboratory can bill under that individual Medicare number. So here's an actual case our investigator shared with us just recently. Here was a marketer that accosted an older, non-English speaking gentleman in a Southern California coffee shop. This happened in Glendale. The marketer told the older gentleman that he could take him to a medical office where he could get a free COVID-19 test. Now, the older gentleman didn't really understand everything the marketer told him, but he did recognize the term COVID, and he certainly understood free. And so he agreed to go. They got in the car. The marketer drove him over 10 miles to some facility. Now, unfortunately, we don't really know what went on at that facility. However, weeks later, when the gentleman got his Medicare statement, it showed that the laboratories that the marketer was working for had billed Medicare for hundreds of dollars in pneumonia tests, over $500 in ultrasound testing, and apparently the labs even colluded with a foot doctor. And the podiatrist used this gentleman's Medicare number to bill Medicare for over $200 worth of removal of thickened skin. The investigators told us when they talked about the case that the gentleman not only did not get a COVID test, he didn't receive any of those claimed services. And yet, they showed up on his Medicare statement under his Medicare number. Okay, I'm going to take a breath, see if there are any questions so far. So far, so good? Okay.
There are questions in the chat.
Yeah, I do have a couple questions here. One is from someone who said, I've seen ads about very inexpensive life insurance on television. Is this a scam as well?
Boy. You know, it's really hard to tell. Unfortunately, those ads are not very much regulated. We see a lot of ads for Medicare coverage, and they might in fact bleed over to life insurance. My advice is always never take that 800 number that's offered on the advertisement. If you're really truly looking for health insurance or life insurance, get referrals from people that you trust and go to trusted sources. And I am going to talk about insurance, healthcare insurance, and healthcare insurance agents in a bit. So I'll hold off on that. But I always advise people to be so very, very careful about advertisements on television.
Okay, thanks. Then one other question here. Does Medicare pay for only one test?
Well, that's a good question. I believe that if your doctor indicates that additional testing has to occur, that subsequent testing would be covered as well.
Carol, I have a question. I didn't write it down. You said that one of the scams was contract tracing. So how would you know if a real contract tracer called you because they heard that you were with somebody that had the virus? How would you?
Good question. And if you would be patient, I'm going to cover contact tracing in detail in a couple of slides. So
Okay.
Hang on there. Okay. Thank you for asking them. Okay.
One other thing.
Go ahead.
When we talked before, you explained, and maybe you'll explain this later, why it's important. You know, people say, well, they billed Medicare and it didn't come out of my pocket. Mm-hmm. So what is the damage that is done to the individual when their Medicare
number is compromised?
Used,
mm-hmm.
Yes.
Yeah, good question. That's a very, you know, when people say, well, I don't care, the government will pay for it, you know, they'll just print more dollars. That is really not true. Medicare fraud impacts the health and welfare of Medicare beneficiaries in many, many ways. So let's put aside the fact that Medicare loses $60 to $90 billion every year due to fraud, waste, and abuse. Picture this. Let's say that you get a call from somebody and they say they're a Medicare representative and you believe that it actually is Medicare. And this happens all the time to people. It's really a scam, but unfortunately, people fall for it. They give up their Medicare number. The individual scammer who's collecting those Medicare numbers is then going to turn that over or sell it to companies and providers who actually bill Medicare. And when they bill Medicare for false claims, they're using your individual Medicare number, the number and the letters and the numbers that are on your little red, white, and blue card. When that happens, every single time there's a false claim used with your Medicare number, it goes on your own Medicare record. That means that, let's say there's cancer scam and cancer testing is widespread, and they're using your number to bill Medicare for cancer screenings, and they're very expensive. It goes on your record. That's falsified Medicare records, okay? Do you really want to show that there are false cancer on your individual record? No, you don't, right? I mean, it could impact your health. Not only that, let's say there's an equipment vendor who gets your Medicare number and claims to Medicare that they sold you a $5,000 electric scooter. That goes on your Medicare record. Now, let's say down the road, God forbid, you need that electric scooter and you have a legitimate prescription for it. Medicare is going to look up your record and say, you can't have another one. You already have one, even though you really didn't get the first one. So you can see that compromised Medicare numbers really impact an individual's health and welfare.
Okay, thanks.
All right, moving on. Okay, all right. So Medicare, as I said, has implemented a lot of flexibility around the rules and payment and coverage. And one of those rules has to do with telehealth. It's telehealth or telemedicine. You probably heard it. Maybe some of you ever even had telehealth appointments with your providers. They clearly get some people health care when they wouldn't have gotten it otherwise. So instead of going to a doctor's office, especially in this pandemic, Medicare telehealth offers doctor visits, psychotherapy, doctor consults, and they use audio and video technology, such as Zoom sessions. Now, this remote visit can occur in your own home, in a nursing home, assisted living facility, a long-term care facility, and Medicare Part B does cover certain of these telehealth services. There may be cost sharing, but Medicare has also allowed providers to waive some of those costs. In all instances, though, the beneficiary and the provider has to pre-arrange the visit, and that telehealth visit is documented on the beneficiary's medical record. Now, in addition to telehealth, there's something called a virtual check-in. That's another Medicare service that Medicare pays for, and it's typically a shorter version of a telehealth session. And it's interesting because both of these are really subject to a lot of Medicare fraud. We had a call a while back from the daughter of a woman who had gotten a less than 5-minute checkup call from a doctor that this woman had not seen in over 15 years. He had her telephone number, and even though she was not even a patient of his anymore, she got a bill for a telehealth appointment. So telehealth and virtual check-ins are definitely subject to fraud. Now let me show you a case in point. We received this report from a California senior who answered her phone, and unfortunately the caller who said that they were for Medicare was really a scammer. And the scammer said she could get free braces if she provided her Medicare number, address, and date of birth. And again, the woman believed the call was for Medicare, so she gave up all of that information. Well, sure enough, she received a box of back braces, knee braces, elbow braces, and shoulder braces. And then she reported it to us because she saw on her Medicare summary notice that Medicare had been billed for a telehealth visit on that same day. And in addition, she got a $25 COVID-19 telehealth bill from a company that she had never even heard of from the state of Florida. And then she found out that a Nebraska equipment company had billed Medicare under her number and had received thousands of dollars worth of reimbursement from Medicare for braces and orthotics. Now keep in mind, she didn't even need all those braces, right? But they're now recorded on her Medicare record. Well, what's going to happen down the road when she actually needs medical equipment? Will those legitimate claims be denied by Medicare? And what about her Medicare number? It was compromised twice, right? Once by a Florida company, once by a Nebraska company billing Medicare. How many more times is that individual Medicare number going to be used to falsely bill Medicare before we can turn off the spigot? Good questions. Okay, let's jump to contact tracing, and thank you for that question here. Contact tracing. It is a legitimate way to track anybody who may have been exposed to COVID-19 and then who they may have exposed. And legitimate contact tracing is an important element in our road to recovery. Well, unfortunately, the scammers saw an opportunity, and now they're pretending to be contact tracers. And the only reason they're doing that is to get ill-gained information like Medicare numbers or bank account information. So depending upon how in each state sets up the contact tracing program, this is what is allowed by the legitimate contact tracers. They can contact you by a phone call, email, or a text. During this pandemic, of course, they will not visit homes to collect the information. And they will ask for a full name and address, health information, and the names of places and people that you have been exposed to. Those are the legitimate ones. But according to the authorities, the scammers are using contact tracing and asking a lot more information. So for example, the fake contact tracers have been known to tell people that they have to pay to be contact traced. The fake contact tracers will be asking for money, Social Security numbers, Medicare numbers. Sometimes those fake contact tracers will ask for banking or credit card information. We have even heard the fake contact tracers asking for immigration status, which is totally disallowed. And many of the time, the fake contact tracers will send people a link or a text message with a link to click on in order to fill out much more personal and private information that you would never divulge to strangers. So we always tell people, never click or download anything sent from a contact tracer. Just be totally suspicious. If you get a robocall and they start asking for Medicare number or your bank account information, hang up. Somebody comes to your door, don't answer, and don't respond to those links or text messages, which is really good advice. Now on the screen, to answer the question, there is a link, californiaconnected.ca.gov. If you have any questions at all about somebody who has contacted you and claims to be a contact tracer, you can contact that organization to make sure it's valid. And at the very end of this presentation, I'll also give you our toll-free hotline. You can certainly call us. We're tracking these fake contact tracers as well. Okay, I hope that answered it. So like I said,
We have one more question here. Maybe
go ahead.
I address it now.
Sure.
Why doesn't Medicare start advertising that Medicare would never ask for your Medicare number like the IRS promotes, that the IRS never requests payments, et cetera, over the phone?
Absolutely. Good question. And I really appreciate that because we ask the same question all the time. Medicare actually has put out some 30-second and 60-second public service announcements, but they're not widely disseminated, which is disappointing to us because we're the ones that try to propagate all the education and awareness that we possibly can. Medicare also posts YouTube posts for those PSAs, but again, they're not widely disseminated, and I agree that it is disappointing because we definitely need to get the word out as best we can, and constantly. One time isn't going to cut it. We need to remind people all the time, which is why as I do these educational presentations, I really ask the people who are tuning into these presentations to remember that for every person that is listening to this message, there's probably 100 or 1,000 people who aren't on this call or this webinar who really do need this information. So you guys can be ambassadors and share the information as well with all those people and get the word out. Okay, moving on. So we talk about all the suspicious links and the text messages, and I do want to point out to you, since the COVID-19 phenomenon, cybercrime experts have told us that they have seen a 1,000% increase in websites and internet names using COVID-19 to attract people to their websites. We see emails, text messages, all with one purpose in mind, to get people hooked, to suck them in and get them to click on the link so that they can provide personal or financial information that we would not definitely share with strangers. So here on the screen, real life examples. These are things that we have seen. An email offering a pandemic survival guide, save yourself and your family, talk about playing on fear, and also about fear. We're always worried. We hear a lot about the limited supplies of protective equipment, hand sanitizers, gloves, ventilators, etc. This email says, hey, we're a big supplier in China. We can get you anything that you need. Just click on our link. And interestingly, I do want to point out, my husband actually got this text just the other day. Our truck was at your house today. You weren't home. Due to COVID, we can't leave your package. Please contact us immediately. And the text message then provided a really suspicious looking link. But how many people are sheltered in place? How many people are hunkered down in their homes right now and ordering things online? So it's kind of believable that you might get a text message, let's say from Amazon or DHL or another delivery company, and says that they're wanting to deliver your package, but they can't. So it's a very clever way to sucker you in to something that's only a scam. And we also see a lot of websites that appear to come from legitimate sources, from the CDC or the World Health Organization or charities. And again, they're just spammer sites, and all they want to do is hook you in, either collect personal and private information, or while you're in their site, download malicious virus software on your computer, which then lurks in the background, collecting your personal private information and sending it back to the scammers. So please be careful, be really, really careful. Now we tell people that if you do get a link, and it appears to be legitimate, but it really is a link from an email or a text, instead of clicking on that, and you really want to go to the CDC website or find out from Medicare what's going on, open up a new window on your computer and then do a search for the legitimate government agency that you're looking for. Because the bad guys, they're just looking to make money. And speaking of money, boy, wouldn't the scammers love to get a hold of our government economic stimulus payment checks. And I tell you, they are trying. There's a lot of money to be made. So here are some cautions that we heard from the Internal Revenue Service. Scammers calling people, emailing people, text messaging people, saying that they have to pay first in order for them to get the check. It's a scam. I got this text message, the second one, just the other day. Text message, $2,500 deposited on your bank for emergency relief. And then it gave a link. I didn't click on it, but if I got it, bet you a whole bunch of other people got it as well. You also need to be aware of callers asking you to sign their stimulus check over to them. Scammers who claim that you have to verify certain personal information and banking information in order to speed up the delivery of your check. And I've also heard people who claim they can help you get your check faster, or scammers who send a fake check and lure you into giving up your bank account information in order to help you cash in. Sad. All scams. Now, many of us have already gotten the government stimulus check, but many haven't. And I do want to share this with you so that you can, again, share this with other people. The IRS recently sent out an advisory about 12 million people who are actually eligible to receive the stimulus payment, but they're missing out because they are non-tax filers or tax non-filers. And these people are typically very low income families with children, people who have been disconnected from work opportunities for a very, very long period, and many low-income adults not raising children in their home currently. And there's a deadline. There's a deadline of October 15th. So, like I said, many people have gotten their $1,200 check. There are still millions and millions of people who deserve it, who need it, but they need to fill out a form, go to the IRS website, and fill out that form to make sure by October 15th. So please share that information. Okay, since the inception of the pandemic, just a few months ago, well, it has been just a few months, there's been such an explosion of phony cures, phony therapies, that the Federal Trade Commission, believe it or not, has had to issue over 250 cease and desist letters to companies who have made unsubstantiated claims for products and therapies that they claim can treat or prevent the COVID-19 virus. Now, at this point in time, there is no cure, there is no therapy, but the scammers will tell you there is. They offer music therapy, vitamin therapy, drinkable bleach. I mean, it's amazing to me what people are willing to do to unsuspecting seniors, all to make a buck. Now, the one thing we know, and we need to keep reminding people, is that there's no cure or therapy for COVID-19. You see, you hear something like this, don't fall for it. It is a scam. Just the other day, I read about a Florida district attorney who secured a preliminary injunction order shutting down the online sale of a miracle cure for COVID-19. I mean, this guy claimed not only it cured COVID-19, this was a cure that claimed that cured Alzheimer's and dementia. The alleged cure involved drinking a powerful and potentially dangerous bleach product. And people are falling for it. So please be aware. Now, just very, very recently, this is hot off the presses, the Food and Drug Administration came out with an alert warning consumers to stop using 55 hand sanitizer products from 10 manufacturers because they may contain methanol. Methanol can be toxic when absorbed through the skin or ingested. Definitely, methanol is not an acceptable active ingredient for hand sanitizers and must not be used due to its toxic effects. And sadly, the Food and Drug Administration has already said they're aware of adults and children who have recently died, been blinded, or hospitalized after ingesting hand sanitizer products contaminated with methanol. Horrible, horrible situation. So please let people know. Now, before I mention genetic testing and cancer screening, back in 2019, this scam was rampant. And the way it happened was laboratories, remember those laboratories who hire the marketers and the recruiters. And these marketers go to senior fairs and health fairs, and they would convince people, mostly seniors with Medicare numbers, that Medicare was offering a free genetic test cancer screening. And this free test would allow people to get a report showing whether or not they were prone to cancer or whether their medications were contraindicated. And all they had to do was give up their Medicare number and do a simple cheek swab test. And thousands and thousands of Medicare beneficiaries across the country fell for this scam, and they gave up their Medicare numbers and they did the simple cheek swab. Well, clearly, they didn't get a lab report, but the laboratories who were scamming those seniors billed Medicare for millions and millions of dollars in false claims for expensive genetic tests. And those genetic tests, again, remember, were recorded on individual Medicare numbers. Now, take that scam, fast forward to 2020. We're already seeing laboratories being investigated for billing Medicare for suspicious COVID-19 testing. So here we go again. Now this time in the state of Texas, a real case here. A Texas laboratory hired marketers, and those marketers went door to door, and they targeted the most vulnerable, the elderly and the poor. And the marketers talked these people into giving up their Medicare numbers and convinced them to do that cheek swab, okay? And for every Medicare number and cheek swab that the marketer got, the marketers were paid by the laboratories $150 a piece. Then those Medicare numbers and the DNA was used by the laboratories. They colluded with the doctor, and they sent claims to Medicare and Medicaid, billing them for $30,000 a test. That is healthcare fraud. Now, if that's not bad enough, I want to talk about this egregious scam. This is a heartbreaker. Bad actors using the COVID-19 diagnosis to fraudulently enroll non-terminal seniors into hospice. That's another real case. In this case, a hospice agency, a new biller to Medicare, tricked a whole lot of seniors into giving up their Medicare numbers in exchange for COVID-19 testing. And then the hospice agency falsely claimed that out of the 41 seniors, only 3 of the 41 tested positive. Now, they sent all of this billing to Medicare for 41 beneficiaries, even though they only tested 3 out of the 41. Now, worse than that, though, The seniors whose Medicare numbers were compromised and then falsely enrolled in hospice, because their Medicare records showed that they were in hospice, they were denied critical healthcare services that they needed, because hospice only provides comfort care. And these people listed here, these are some of the actual victims. Bree needed heart surgery. Her heart surgery was denied because her Medicare record showed she was in hospice. Betty, another beneficiary who was tricked into enrolling in hospice, she was denied the ability to see her own primary doctor. And John enrolled unsuspectingly in hospice, couldn't even get his regular medications. There's no doubt about it. Fraud harms people, and sometimes the harm can be deadly. Any questions so far?
Yeah, we have one question, and someone wants to know, where can we find a list of the hand sanitizers that we should avoid?
Good question. I will send a link to you, Carol, and can you make that available?
Yes, absolutely.
Perfect. Okay, I will do that right afterwards.
And then someone gave us a link on our chat and sent it to everyone, of a list of all the approved hand sanitizers by the FDA.
Ah, perfect. Very good. Okay, all right. Moving on. Lastly, we want to talk about health plan insurance agent marketing misconduct. Now, Medicare sets out a whole bunch of rules for Medicare Advantage health plan insurance agents about what they can do and what they can't do. But, you know, there's telemarketers who don't care about the rules, and this is what I want to talk to you about. So there are telemarketer robocalls, and they're taking advantage of people, vulnerable people who've lost their jobs and their health insurance because of COVID-19. Now, this is what the telemarketer robocall says. Looking for affordable health insurance with benefits from a company you know? Policies have been reduced nationwide. Big name companies, just a quick phone call away. The robocall goes, press 3 to get connected to a licensed agent, or press 7 to be added to the do not call list. Yeah, well, that's the way the robocall goes, and people are falling for it. So when a customer presses number 3, they actually get connected to a telemarketer. But the telemarketer is not offering plans from big name companies. They're offering substandard health plans that clearly are not correct, not right for the people who have lost their jobs and their health insurance. Now, investigators have been looking into some of these telemarketers, and these telemarketers telling the investigators, they're admitting actually that they reached out knowingly to consumers who were listed on the do not call list because he believes they would be much more profitable to target. The telemarketers are already also admitting to the investigators that they make millions of calls a day using spoofed numbers. Now, for those of you who don't know, you know, when you see on your phone that little LED display that's supposed to show where the incoming call is coming from, telemarketers and robocallers, they know how to spoof that to show that it could be coming from a local area code, or it could be coming from a legitimate agency like Medicare or Social Security. So you need to be super, super careful. And it's so sad. But in talking about health insurance, I always want to tell people, yeah, 99% of insurance agents are legitimate and they're good folks. But if you're really looking for Medicare information, if you're looking maybe to change during open enrollment from one Medicare Advantage plan to another, you want to go back to original Medicare, vice versa, I always recommend the HICAP. That's the Health Insurance Counseling and Advocacy Program. There are 26 HICAPs in the state of California, and they're not insurance agents. They don't sell anything. They provide free, unbiased information about Medicare and Medicare Advantage plans in that particular county. So you're getting the most current information about everything that's available to you so that you can make informed decisions. And I did list here the 800 number. That 800 number goes to a source that can tell you which health insurance counseling and advocacy program is in your particular county. So I do highly recommend that.
We have one other question here. How does the fraud impact what we hear from news organizations regarding the number of COVID-19 patients?
Not quite sure I understand what you're asking there.
So we hear these numbers of how many COVID-19 patients there are across the country, you know, people who have been diagnosed, and she's wondering how does fraud impact what we're hearing? I mean, Jan, maybe you want to make your question a little more clear then, if it's not fully understood. We'll get back to that.
Well, I'm just thinking that I'm just wondering about the numbers, because if there are all of these people that they're saying they're testing them and they're reporting the testing that they've been tested, but they haven't been, if those numbers are going to whatever organization collects the numbers, CDC, or now not the CDC, it seems to me like it would falsify, and a lot of people are actually telling me this, that there's falsification of numbers. Anyway, I'm just wondering how all of this fraud impacts
That's a very interesting question, Jan. I honestly can't tell you. It could very well be that it is impacting the numbers. I don't know that. In many instances, though, remember, the scammers are pretending to do COVID testing when they're actually not. So keep that in mind as well. Interesting question. Okay, so as they say, so little time, so many scams to talk about. So in the next few slides, I'm going to detail what I call the self-defense tips. And again, I really appreciate if you would take this information, share it widely, so that people really don't get victimized by these horrible, horrible criminals and scammers. Now we're being inundated. Every single one of us, I think, is being inundated with billions of robocalls every day. But we also know that scammers are going door to door, selling virus test kits. Even though, as we talked about, Medicare has already indicated that there will be no cost sharing for the COVID-19 or the antibody test. We received reports about facilities actually doing the COVID testing, refusing to bill insurance, and then charging seniors anywhere from $50 to $250 a test. Watch out for the many, many products claiming to cure COVID. I would recommend always going to the ftc.gov website to find out about all of these unsubstantiated claims. The scammers, they'll try to tell you that there's a vaccine already. There is no vaccine. Ignore those offers. Ignore people who claim to be a contact tracer if they ask for your Medicare number or your bank account information. And I know that these slides, Carol will share these with you, so you can go to that website that I put on that slide to see if in fact you have been contacted by a legitimate contact tracer. And always, always be suspicious of the websites and the emails and the texts claiming to be from a legitimate site, because many of them are not legitimate. I always advise people to carefully research charities. There are so many scam coronavirus donation requests, phony charities, crowdfunding, and granted, there are legitimate charities created to help those impacted by COVID-19, but there's way much, a lot of scams. Scammers urging Americans to assist those who are suffering as a result of the virus outbreak, but they're only seeking your banking information and credit card information. And crowdfunding, those sites are popping up everywhere. So please be suspicious, check them out carefully. And I did put a link to Charity Navigator, that's charitynavigator.org. They compile millions of records about these charities, and they do rate over 10,000 charities, given a whole bunch of criteria. So check out the charities. Now, investment opportunities, you know, in this pandemic, unemployment is high. People are worried about their 401ks. Crooked investments are rampant. So be really careful. And when you need medical supplies, please share this widely. Don't get your medical equipment from a stranger or a robocaller. And please remember, Medicare will never call you and ask for your Medicare number. I mean, it sounds like it's common sense, but believe me, we get calls daily from people who are tricked into giving up their information, and then they're embarrassed and humiliated afterward. It's a horrible situation. To see if you need medical equipment, always consult with your own doctor. And if you receive boxes of braces, like a whole bunch of other people have, and you didn't order them, refuse the packages. It's almost certain if you get boxes of braces and you didn't ask for them, that some illicit equipment vendor is billing Medicare for thousands of dollars under your individual Medicare number. And as we talked about, telemarketers falsely claiming they can get you the best health plan money can buy, and it could very well be a scam. So remember the HICAP, Health Insurance Counseling and Advocacy Program for unbiased information. And as far as telehealth and virtual check-ins, if you get a request for a telehealth visit, verify that appointment with your own doctor first. Don't fall for a scam telehealth. And importantly, review those Medicare summary notices and explanation of benefits from your MA plans. So the Medicare summary notice is sent to you every 90 days if you have had any service or supply and you are on fee-for-service Medicare. That is not an HMO. If you're an HMO, Medicare Advantage member, you get a monthly explanation of benefits. And those statements tell you exactly what is being recorded under your own individual Medicare number. So it's in your vested interest, just the way you look at your credit card statements and your banking statements, to look at those medical statements to make sure it shows a date of service. Is that in fact the real date when you did get a service? Did you actually go to that provider? Do you recognize that name? And did you get the description of the service on that particular day? Because if any of that sounds suspicious, it could very well be fraud. And as difficult as it is, keep current with Medicare, COVID scams, and healthcare fraud. Like I said, they're evolving over time. The criminals, boy, they just always seem to be one step ahead of us. So we need to be on the defensive. Now, I took all of the information that I just talked about, self-defense tips, and I published them in a one-page flyer called COVID-19 Self-Defense Tips. And I will make that available to Carol for distribution, but you can also find it on our website at cahealthadvocates.org. And in addition, report fraud. It's the only way that we can help law enforcement get the bad actors out of the system. Now, in California, our Senior Medicare Patrol toll-free hotline is open for calls, complaints. just if you have a question about Medicare billing or you're suspicious about something, give us a call at that toll-free number, 855. We also have on our website there, cahealthadvocates.org, we routinely publish and disseminate to all of the villages, by the way, fraud alerts, and we publish those in 9 threshold languages. All of those fraud alerts, webinars, newsletter, all of our education is free and open to the public because information is awareness. And if people are aware, they're far less likely to fall victim to the scammers. So I just want to leave you with this one plea. Please share this knowledge. Tell everybody that you know. If you're a professional, share it with your clients. If you're a service coordinator, share it with your residents, friends, relatives, families. The more they know, the less vulnerable they are to being victimized by the fraudsters and the scammers. And you can see by everything I told you, fraud and abuse is rampant. Protect yourself, protect others. And I want to thank you for your attention, and we can open it up to more questions.
We don't have any more questions, but I really want to thank you, Micki, for all this incredible information that you've provided for us. And this has been recorded, and we will have it available not only on our YouTube channel, but also on our Clayton Valley Village website too, so that if people want to, who weren't able to come to the meeting today, they can share it. But even those of you that were here and you want to kind of refresh yourself and refresh your memory about what was presented here, it'll be available. And Micki, you are going to be sending me the slides, correct? That we can send out to everyone who was a participant here.
Yes, absolutely. I will send you the slides, the self-defense tips, and also the link to those 55 dangerous hand sanitizers. And I just want to say one last thing. If you're not part of the village, and I'm so glad that that Carol made it available widely, but if you are interested in, maybe you belong to a Kiwanis or a retired teachers organization or some other organization, and you think that this information would be of value, please get a hold of me at that toll-free number, and I'd be happy and very, very happy, in fact, to do a similar webinar for your organization as well. And Carol, I want to thank you again for this lovely invitation, and thank you guys for tuning in.
Yeah, thank you, Micki, so much. And one question here, are you willing to have people contact you if they want you to do a presentation for their group?
Please, please take down this, this telephone number, 855-613-7080. That's our toll-free number. And just, you know, leave a message. I promise I will call you back.
Carol, there's a couple more questions there. Sonia wanted to say something. Sonia, did she hear me?
I don't know. I don't know.
I just unmuted. I did want to mention just a few days ago, over my landline, a voice message that came from someone with a telephone number regarding that I was going to be served by somebody the following day to go to the sheriff's department in person, and that all my benefits were going to be canceled, etc. I knew it was a scam, but what I did is I called our local Clayton police, who confirmed it was a scam, and I did I reported it on the Social Security fraud website part of it, and gave the number that they gave, plus I blocked it with AT&T. I don't know if that was all overkill or not, but it did involve Medicare benefits through Social Security. And it was, of course, a scary kind of call.
Absolutely, Sonia, and good for you that you did all that. There's a lot of people that would get a call like that and just kind of, shrug their shoulders. I always ask people not only to let us know, because we compile that data and we refer it on for investigation if possible, but I'm glad that you called the police. I'm glad that you reported it. Because again, if we don't know what's going on out there with the bad guys, we're never going to stop them. So thank you for doing all that.
Okay.
Okay. So Micki, thank you again for this really informative presentation. And like I said, it will be available on our website too. So thank you so much. We really appreciate it.
You are more than welcome. Bye-bye, everybody.
Bye.
Bye.